Prostate cancer is the most common type of cancer in Canadian men. Last year, 4,300 men died from prostate cancer, and over 20,000 men were diagnosed with this disease. In order to save lives, there is a pressing call for new tests to detect prostate cancer both early and accurately. Fortunately, researchers at the University of British Columbia think they have come up with a new test that could increase the reliability of prostate cancer screening. Dr. Eric Legale of the Michael Smith Laboratories at UBC is one of the driving forces behind this research. He believes that the current screening methods are inaccurate.
There are two standard clinical tests. There's one that's known as the DRE, the digital rectal exam. That's where the physician inserts a finger into the rectum and feels for hard areas on the prostate. That is got very low specificity, so hard areas on the prostate are not necessarily indicative of cancer. It depends a lot on the physician's experience. So inexperienced physicians will miss a lot of things that more experienced physicians won't. So that's not a terrific technique, although it is sort of the first test that will happen. The more clinical diagnostic test is the prostate-specific antigen test, or PSA. Take 100 men and you test them all for their PSA levels. You'll see elevated PSA levels in 10 of them, typically. Those PSA levels, however, will indicate cancer in 10 of these individuals. Only 3 of those individuals out of that 10 will have that cancer, and it will actually miss 2 individuals. That is, 2 individuals out of that 100 will have cancer, but their PSA levels will not be elevated. So you've missed 2, and you've misdiagnosed 7.
Dr. Legale and his team hope to reduce diagnostic errors. They have developed a new test that measures the level of the biomarkers specific to cancer cells. Biomarkers are molecules in the body that differ between healthy and diseased individuals.
All the work that's been done in cancer diagnostics recently has suggested that one biomarker is good, but a panel of biomarkers is typically going to be required for cancer diagnostics. If you test them in parallel, then you'll get a profile for each individual. Some markers may go up, some markers may go down, and by looking at that profile across multiple biomarkers, you have a better chance of detecting the cancer specifically.
Dr. Legale's biomarker is a cellular machine, or enzyme, called telomerase, which helps to prevent our cells from dying early. His test uses a new technology called microfluidics.
Microfluidity, or microfluidics, is essentially a technique where we're using small amounts of fluid in channels and chambers that are at or smaller than the length scale of the width of a human hair, which is 1/10 of 1 millimeter. So a microfluidic chip is essentially a combination of these channels and chambers to perform a specific test or experiment.
The microfluidic screening method has many advantages. It is able to precisely distinguish between cancer cells and normal cells. And since that technology is so small, it uses very little power.
If you compare it to a light bulb, which might be 100 watts, we are essentially using as much power as 1/1,000,000th of a light bulb.
This technology will be affordable, since the chips can be mass-produced. Implementing this test in the clinic, alongside the PSA test, should be simple.
The ideal case that we had in mind when we started developing this chip was that we would be able to use it directly in the clinic or at the bedside in a hospital, for example. And so ideally a nurse or a nurse practitioner or a doctor would be able to administer this test simply by using a drop of blood. If you've ever had blood drawn at the doctor, you know that they fill up an entire test tube with your blood. What we'd like to do is minimize that blood draw.
Dr. Legale believes that microfluidics will emerge as a front-runner among diagnostic tools in the upcoming years. A greater reliability in cancer screening will save money and lives.